Hi, how are you? I'm so sorry to wake you, but it is time for your head to toe exam. Your last checkup was 3 hours ago, but we need to stay on top of your pain and just track your progress, okay? Alright, so this should go pretty quickly. Just relax, you won't have to do much. I want to verify your cognition right now and just see where you're at mentally. Do you know your first and last name? Okay. And your date of birth? Great. Do you know what month it is now? Excellent. Okay. So I'm going to go ahead and put on some gloves and begin the exam. On a scale of 1 to 10, what's your pain right now? Okay, about a 6. How is that leg? Okay, still numb. Alright, so we're going to go ahead and give you some more pain medication in about an hour. But for now, it's good to know that you're not feeling anything, because when you do start to feel, it's going to be very painful. Okay, so we want to kind of nip that in the bud for now. How is your head? Okay, so still a headache. That's about a 7. Okay, so sorry to hear that. We're going to give you some more pain medication for that, but we're going to wait until after the exam, just so you won't have the drowsy effects and you can just gauge neurologically where you're at. Okay, so I'm going to start by listening to your heart and your lungs, okay? So, you can breathe normally for me. You don't have to do anything. Just breathe as you would. Okay. 2. Very good. Now, when you were first admitted, you had a rapid heartbeat. That's no longer the case. I'm feeling a very steady heartbeat, and it sounds normal. Okay. Are your feet uncrossed? Yes. All right, I'm going to listen on the bell side. I'm just listening for any murmurs. Perfect. Okay, very good. Okay, I can only hear S1 and S2, no S3. So I'm pleased with that. I'm going to go ahead and take your blood pressure. I'm going to use this arm. Okay, is that comfortable for you? Okay. Very good. All right. Okay, that is 109 over 69, so that is actually very good. Excellent. All right, taking your temperature. Okay, so that is 99.8, so it's a little bit elevated. Okay. Okay. All right. So since we're focusing on your head pain, I'm going to palpate your head, okay? So I'm going to get a little bit closer if you don't mind. I'm just going to be feeling for any lumps or contusions. Okay. Okay. That sounds normal. I'm going to go back here behind the mastoid bone, okay? just to feel your cervical spine. Okay, sounds normal. Okay. I like to go ahead and just take a look at your scalp. I just need to make sure that there's no irritation there, so I'm just going to be brushing through with a fine-tooth comb. Okay, just going to be taking a look here. Alright, I don't see anything except for some light dandruff. Very good. And just look at your hairline. Okay. Alright, I don't see any problems there. A little bit of dryness, just some slight flecks, but nothing to be too worried about. So, yeah, your hair is fine. Have you had an itchy scalp in the past? Okay. Alright, very good. I'm not too worried about that. Okay. So next I'm going to just palpate your face. So I'm just feeling below the sinus cavities for anything that might, stick out as edema. Just feeling right here. Okay. Okay. I'm going to feel your lymph nodes right now. Non-palpable preauriculars. Non-palpable post-auriculars. Very good. I'm going to feel the lymph nodes right here, right underneath the jaw. Okay, and I'm feeling here for a swollen trachea. Very good. Your thyroid is normal in size, so that's good. Okay, I'm going to measure your face right now. I'm just looking for signs of symmetry. Okay. Okay. That's 5 here. It's 2.5 on this cheek. Okay, that's 3. Look at your forehead. You're doing great. That's 2. Alright, I'm measuring here just from the tip of your nose to your chin here. Okay, that's a normal dilation. Okay. Normal here. Okay. I don't see any signs of swelling. I'm just going to check again underneath your sinus cavities. Okay. Nothing to be worried about. I'm going to take a look at your skin. I'm just looking for signs of redness or irritation. Okay. Okay. Sorry about the bright light. Your skin looks healthy and well perforated. Okay. Very well perfused. I don't see any signs of jaundice. So, that's a sign of good liver function. Okay, let me see your mouth. Could you open your mouth? Okay. Okay, keep your mouth open for me. I'm just going to be looking here. Excellent. Alright, no swollen tonsils. A little bit of dryness in the mouth. So You do seem a little bit dehydrated. That might explain your fever. Very slight fever. Okay. Okay. Go ahead and stick out your tongue for me. Alright, wave it from side to side. Like that. Up and down. Did you have any difficulty doing that? Okay, great. So, I'm just going to test some of the strength in your face, your muscles. So, I'm going to be placing my index fingers right here on the bridge of your nose. Okay? On the count of 3, I want you to go ahead and try to turn your head this way. I'm going to resist your push. Alright, 1, 2, 3. Very good. Okay, let's do the other side. So turn your head this way. 1, 2, 3. Excellent. So that was very strong. Not too worried. I'm going to do the same thing, only I'm going to be bringing my hand right here by the ear bone. Okay, so try to turn your entire face this way. 3, 2, 1. Good. Okay, the other way. 3, 2, 1. Excellent. Any trouble doing that? Any soreness? Okay. Try to look up at the ceiling. I'm going to place my fingers right here on your chin. 1, 2, 3. Okay, was that the hardest you could go? Okay. Alright, try to place your chin to your chest. So look down for me in 1, 2, 3. Okay, any difficulties? Seemed a little bit weak in strength, but that's okay. I'm going to have you raise your eyebrows. Okay, now try to lower them in 3, 2, 1. Alright, that was great. So try to frown for me. Great. Now try to raise your eyebrows in 3, 2, 1. Okay, do it again. 3, 2, 1. Okay, good. Widen your eyes. Very good. Okay, open your mouth for me and close. Like that. Okay, do it a series of 5 times as fast as you can go. Okay. I see symmetric musculature, no drooping. One side of your mouth isn't going a little slower than the other, so that's good. I'm just looking for neurological signs of a stroke or any kind of other problems. Okay. No drooping of the facial features. So you look to be doing good. Okay. So you had some tingling on the left side when you came here. I'm going to do a sharp and dull test just to gauge whether you're having numbness or any strange sensations. Okay? Okay. So this is going to be a dull sensation. Do you feel that as a soft sort of tickle? Very good. Okay. And this is kind of a poke. Oop, wrong side. This is a poke. Okay, so that's going to be your sharp sensation. So say sharp or dull. Go ahead and close your eyes and relax, and you can just say it in a whisper if you want. You don't have to effort too much. All right, close your eyes. Okay. Yes. Very good. Great. All right. Excellent. And what side of your face did you feel that on? Okay, so from now on, I'm going to just use the sharp implement and to just tell me what side of your face you feel it on, okay? Great. Okay. Excellent. So with this tool, I'm going to be starting with your forehead and going to your chin and gradually just dragging the implement down. Let me know if you feel it all the way, okay? So I'm going to start and stop. Starting and stopping. Did you feel it all the way? Good. I'm going to do the same thing except starting from the center of your face and going to the sides. Starting, stopping. Did you feel it all the way? Starting, stopping. Did you feel it all the way? Good. So just say yes or no. Good. Good. How is that temperature-wise? Does that feel like a cool sensation or warm? Very good. Okay. I'm going to test your temperature sensations on your face now just to be sure. Alright, so this is going to be a cool sensation. Do you feel that? Good. This will be warm. So say cool or warm. Yes. Okay. Okay, so you didn't feel that at all. All right. Okay, the upper right side seems to be a little bit having loss of sensation. What about this? That was warm. Okay. So, neurologically, you still seem to be having a bit of numbness, especially when it pertains to temperature, but your perception of sharp and dull is good, which is really more important. So I think we're making progress since our last exam. Go ahead and say cool or warm. Yes. Good. Good. Yes. Okay. Alright, so next I'll be doing a pressure point test. Do you see this as one pressure point or do you feel it as one? Close your eyes. Let's do it again. Great. Okay, so that's going to be 1. Do you feel 2 different pressure points there? Good. That's going to be 2. So say 1 or 2. And keep those eyes closed. Thank you. Good. Yes. Excellent. Mm-hmm. Okay. Okay, good. Very, very good. Okay, so again, the upper right side seems to be a little bit where the problem area is. So, okay. No, that was 1. All right. So I think you got about a B on that if we're going to give you a grade. And so let's say last time it was a C. So there is some progress, but you're still not out of the woods when it comes to your neurological functions being intact. Okay. Okay. And how is your vision? Okay, good. Can you tell me how many fingers I'm holding up? Okay, what about now? Okay, what about now? Good. Now? Good. Now? Alright, so no double vision that I'm too worried about. I'm going to take a look at your pupils. Okay, coming a little bit closer. Okay. I see that they are healthy and clear, no dilation. Okay. No irritation or jaundice. Alright, any itchiness in the eyes? Alright, good. I'm going to go ahead and look at the other one then. Beautiful. Okay. Why don't you look up at the ceiling for me just with your eyeballs, so keep your head straight. Okay. Now look down. Good. Okay. Now to your right. And to your left. Okay. Now move to your right and left as quickly as possible. do a series of 2 or 3. I'm just gauging your ability to. Okay. The musculature is in your eyes, the iris and cornea. They're all having healthy and normal reactions. So that's good. Do you wear contacts or glasses? All right. So go ahead and take a look at this Snellen chart. Can you read this row for me? Go ahead and try to read it. Good. Okay. Can you read this row? I'll bring it a little bit closer. Can you read it the other way? Okay, no. Okay. So you got the T and the P confused. Okay, which might be a sign that you are nearsighted. And that you might need to up your prescription. Yes. Okay. What about this row here? Very good. So I think you do need to up your prescription. What is it right now? Okay. Well, I can refer you to an optometrist, but I'm thinking right now that you need to be negative 2.50 on the right eye instead of negative 2.25. It might be a slight change, but you are almost there. You just got these two confused. What about this row? Again. Great. And this top letter? Very good. All right. These are 2 circles I'm going to be pointing to. Number 4 and number 7. Do you see those little numbers? No? Okay. Can you tell me which circle is larger? This is 7. This is 4. Good. All right. This is 2 and this is 8. Which is larger? Very good. Okay. All right. And which is larger? Number 3 or number 2? Very good. Number 2 or number 9? Yes. Excellent. What color is this? Good. What color is this? Excellent. Okay. We're going to be doing some object identification. Okay. So I'm going to open this book and I'm going to show you a series of different objects. Just name the object to the best of your ability. Okay. Yes. Very good. Okay, what about this? Okay, what about this side? And this side. Very good. All right, say it again, this side. And this side. Very good. Okay. What about this side? Good. What about this side? Excellent. Okay. And what about these? What shape are they? Very good. Okay. All right. And what color is this woman's robe? Good. Okay. Are her eyes open or closed? Okay. How would you describe these patterns? Are they similar or different? They're similar, so what would you call them? Camouflage. Good. Okay. And what's the background color of this? What shade? Good. How would you describe this object? Very good. Okay. So these are a series of words I want you to go ahead and read. I want you to read this word. Good. And what's the color in the background? Good. And so read this word. Color in the background. Good. And what about these last two? Very good. Okay. So, describe this object here. Very good. What are these objects? What color are they? Can you visually describe the texture? Yes. Just a couple more. Okay. All right. So we have two pieces of fruit. Are they the same fruit or are they different fruit? They're the same. What color are they? Good. And what about this? How would you describe this? A clock radio. All right. And what would be the time on the clock? Very good. And what color is this frame right here? That's red. Excellent. So, I'm pleased with that. I'm going to be bringing my fingers in your field of vision. Let me know when you see my fingers, okay? Say now. Yes. 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 Mm-hmm. Yes. Good. Good. All right, so these set of fingers are on your left side. These are on your right, so let me know which ones are moving. Good. And are they closer or further away from the other? Good. Good. Both. Yes. Mm-hmm. Neither. Very good. One more test. Just follow this light for me with your eyes. Keep your head straight. I just want to see your eyeballs move. Mm-hmm. Perfect. Okay. I'm going to take a look at your nose. If you could tilt your head up, I just want to see inside your nostril. Okay. No polyps here. It looks clean. No irritation. Okay. I don't see any signs of a deviated septum. Have you ever been diagnosed with one? Okay. Do you snore at night? All right. Let me go ahead and look. Look very healthy to me. All right. So next I'm going to take a look inside your ears. If you could turn your head this way, I'm just going to be looking inside. Okay, tympanic membrane is pearl gray. I don't see any wax. Have you ever been diagnosed with a hearing aid? Any hearing issues? All right, I'm going to look again here. Looks healthy to me. Go ahead and turn your head this way. Okay, a little bit more wax on that left ear. Not to be concerned. I don't see any scarring, scratching, or infections. So I think you're in the clear there. So this is a tuning fork. I'm going to be making a couple different positions here. Position 1, position 2, which sounded louder. Good. Position 1, position 2, which was louder. Position 1, position 2. Good. Position 1, position 2. Okay, now I'm going to be placing it at different resonance points in your skull. So you're going to feel a sensation rather than hear it. Let me know when it stops, okay? And if you don't hear it at all or feel it at all, let me know. Good. Yes. Okay. I'm going to be making some rustling sounds on both ears, okay? Let me know if you hear it on your right or your left ear. Keep your eyes closed for me. Good. Good. Excellent. All right. I'm going to whisper some words in your ear. Close your eyes. Repeat exactly what you hear after me. Okay. Christmas. Shopping. Alright, I'm not too worried about that. I'm going to be palpating your chest next. I'm just feeling here for any signs of swelling or protrusions or any hardened lumps, which could be signs of a blood clot or mass. Are you warm under this blanket? It's very warm. It's one of our warmest. Okay. I'm just trying to palpate here. So next, I'd like to perform an abdominal exam. I'm just going to be lifting the blanket and taking a look at your skin, listening for different sounds of the stomach, and doing some palpations. I'll be listening for any hardness, lumps, swelling, or enlargement of your organs. Okay, excellent. And I'm not going to go any lower than this groin area to feel your lymph nodes and your hips, okay? And I'll let you know when I do that. Okay, great. Okay. So I'm going to start just by doing some palpations. Any pain here? Okay. Any soreness? All right. Your liver feels like a normal size. So does your spleen. Very healthy. Okay. I'm going to go lower just to palpate the lymph nodes. Okay. And they are non-palpable, so that's excellent. Just feeling a little bit more here. All right. Very good. Okay. Excellent. All right, I'm going to be listening to different sounds of the stomach. Oops. Okay. Okay. Okay, very good. Normal acidity buildup. Normal regurgitation levels. Okay. How's your digestion? Do you have any bowel issues? Any diarrhea or constipation? Okay, I'm hearing very healthy sounds here. So that's good. Okay. Right. We're going to be doing some percussions, okay? Okay, these are normal reflexes of the skin. Okay. Any pain? Good. Excellent. Okay. We're going to be doing some neurological testing. Do you feel this tickle? Did that tickle? Okay. So that's going to be a dull sensation. This will be sharp. Did you feel the difference? Okay. Go ahead and close your eyes and say which one you feel. Good. Yes. Okay. Good. Excellent. Okay. Okay. This is going to be a cold sensation. Do you feel that? All right, and this will be warm. So go ahead and say cold or warm. No peeking. Yes. Good. Okay. And which side of your stomach do you feel this warm sensation on, your left or your right? Good. What about here, your left or your right? Okay, your left or your right? Good. Good. All right. I'm pretty pleased with that. I'm going to go ahead and move on to your legs and your feet, okay? I'm just palpating the legs here. Any pain? Good. Okay. I'm going to be squeezing your knee joints. Let me know if you feel your right knee or your left knee have that pressure. Good. Nice. Yes. Going down to the calves. Right or left? Good. Very good. Good. And your ankles. Excellent. Just going to measure for swelling. Perfect. Perfect. Okay. I'm going to take a look at your feet now. Okay. Going to judge your capillary refill. Do you have coldness of the feet? Okay. 2-second capillary refill, so that's perfect. All right, I'm just going to be measuring for symmetry here along the pads of the feet. Very good. Excellent. Very pleased with that, okay. I'm going to be performing a Babinski response test, okay, so you don't have to do anything. Okay, very good. It's a normal reaction. Does this feel sharp or dull? All right. You can look up at the ceiling or close your eyes. Sharp or dull? Good. What about now? And now? Good. Sharp or dull? Sharp or dull? Good. Sharp or dull? Excellent. Very good. And did you feel that on your right or your left foot? Good. Right or left foot? Right or left? Go ahead, keep saying right or left. Okay. All right, I'm very pleased with that. All right, so this concludes our exam today. I performed a series of neurological tests and they came back mostly normal. You're still having some issues on your upper right side of your face, so I went ahead and wrote that down. I took your temperature and it's a bit high, so we're going to continue to monitor that and we're going to give you your pain medication here shortly. Do you have any questions? Okay, it's so important that you drift off to sleep right now. So have a nice rest. Your body needs to repair. And to repair, your body needs to sleep, okay? All right. So I'll be back to check on you soon. Have a lovely, relaxing sleep, all right? You deserve it.